So welcome again to a very important part of our presentation. The cofactors mandatory for vitamin D activation, and these cofactors are actually so necessary and mandatory for the overall success of the Coimbra Protocol, as we call it. So here's a list of some essential cofactors and associates. Now these are literally, the king, which is vitamin D, and its army. So the vital minerals or the raw materials that vitamin D needs to not only get activated and synthesized, but also our body. So there is an interdependent correlation between all of these cofactors and associates, and the body consumes these on an ongoing basis when we are dosing the D3 levels higher in an autoimmune patient or even a normal person who simply needs to supplement and keep themselves healthy. But the dosages, as we explained, are very different and person to person dependent. Okay, so the first one is magnesium, and then there is selenium, there is zinc, there is riboflavin, which is called vitamin B2, methylcobalamin, which is vitamin B12, omega-3 fatty acids, and vitamin K2. Now these are the bare basic cofactors and associates which are needed for the entire line of treatment to be successful. So yes, it may look a little extensive, but these are the ingredients that the body really needs to thrive in its own self. Now, unfortunately, we do not get most of them anymore from our foods because our food is highly processed, severely deficient of most of this nutrition, including our soil actually being severely deficient, in which case our plants or the foods, including let's say non-vegetarian foods, none of us are getting this anymore from any of the right sources, especially our foods. Let's start with the first one, which is magnesium. Now, the way how vitamin D is the miracle molecule, magnesium is your miracle mineral. Yes, my friends, magnesium is needed for activation of D3 at every step of the pathway. What does vitamin D need to be activated? Magnesium. Magnesium assists in activation of vitamin D, which helps regulate the calcium and the phosphate homeostasis to influence the growth and the maintenance of bones. So yes, it's not only the calcium which is needed, but also magnesium, which is essential for our bone health. All of the enzymes that metabolize vitamin D seem to require magnesium, which acts as a cofactor in enzymatic reactions in the liver and the kidneys. Magnesium as a mineral has more than 300 plus enzymatic functions. So do I need magnesium to absorb vitamin D? Yes, magnesium is absolutely essential in metabolism of vitamin D, and taking larger doses of vitamin D can induce severe depletion of magnesium. So adequate magnesium supplementation must be considered as an important aspect of vitamin D therapy. Now magnesium, I'm just giving you an overview of the wonder mineral that magnesium is. So magnesium is used in 300 reactions in the body, important for bone health. It helps keep the blood pressure normal, promotes restful sleep. It is great for muscle health, needed for vitamin D assimilation. It helps weight loss. It is also helpful in pregnancies. During the last 40 years, thousands of studies and research documents have been published proving that magnesium is crucial nutrient supporting more than 300 functions in your body. So we need to supplement on magnesium. Which format of magnesium? We will see this in the next couple of slides. But let's start with understanding symptoms of magnesium deficiency. Yes, magnesium deficiency can play an absolute havoc in the body. So right from anxiety to weak bones, irritability, low energy, headaches, weakness, abnormal heart rate, inability to sleep, muscle tension, spasms, cramps, fatigue, PMS and hormonal imbalances. If you are listening to this or if you're watching this slide or this image, does it ring a bell? Have you been trying all sorts of different foods and different types of pathies and going to different specialty doctors for your problems without fixing your simple magnesium deficiency? If yes, you need magnesium, my friend. So biochemical functions of magnesium. Magnesium is the most critical mineral required for electrical stability of every cell in the body. Magnesium is required for the formation of bones and teeth. This image tells us how a healthy cell looks like, where calcium, although calcium is highly overrated as a supplement, technically should not be supplemented, because our foods are very calcium rich, and if our D3 levels are adequate, our body is capable of absorbing calcium from our daily foods which we are consuming. But proper magnesium levels keeps the calcium levels in check. So a lot of stiffness is, for you to understand, calcium governs the contraction mechanism of the muscles, and magnesium governs the relaxation function of the muscles. So in an unhealthy cell, there is a lot more calcium, or calcification as we call, in which case there is a magnesium deficiency, which allows too much calcium also into the cell, and that is an unhealthy cell. Functions of magnesium metabolism. In the cardiovascular system, it has a blood pressure lowering effect and reduces the heart rhythm problems. At the muscle level, it counteracts the calcium, inhibits the overall excitability of the muscles, and reduces cramps. Now, if you are someone who also works out on a regular basis or a daily basis, or you are a fitness enthusiast, every time you are working out, you are consuming a lot of magnesium, and you are just not getting the sufficient amount of magnesium from your foods, in which case supplementing magnesium is an absolute mandatory for you, my friends. The nervous system, magnesium helps reduce the excitability of the nerve cells and has a calming effect. Magnesium also plays a role in the metabolism, where it is essential for energy metabolism and important for protein synthesis. When I also say metabolism, magnesium is pivotal in the overall insulin sensitivity of the body. So magnesium deficiency is a common factor associated with insulin resistance. Yes, type 2 diabetes is an ailment of insulin resistance, and what I just mentioned, if you correlate, magnesium deficiency is also at the root of insulin resistance, in which case if you start supplementing with magnesium correctly, your insulin sensitivity will improve, in which case your type 2 diabetes has a high chances of being better managed much more naturally. Now, this is not a direct replacement to what you may be undertaking as a drug therapy, but the dependency or the dosages of those drugs can actually eventually come down. So why are we so deficient? We are increasingly stressed out, and stress hormone production requires higher levels of magnesium, and a stressful experience leads to depletion of magnesium stores from the body. And our body is so capable, because magnesium is a very tightly managed mechanism, where it is stored at the tissue level and the bone level, and only 1% is in the blood circulation. All right, so there is no real methodology of actually testing the magnesium levels, because what we get as a test report is a serum magnesium, but what we need is probably at best a muscular biopsy is what may help, but again it is inconclusive. Also, we are eating more sugar than ever. For every molecule of sugar we consume, our body needs, or it uses 54 molecules of magnesium to process. Low levels in the soil and modern farming techniques deplete the magnesium. Far less magnesium in bottled or softened waters is also what we are observing. So why are we so deficient? 80% less magnesium in refined wheat, in white versus brown rice. Magnesium is depleted by many pharmaceutical drugs, especially the H2 receptor blockers, excess calcium supplementation, steroids like cortisone and prednisone, blood pressure medications also deplete magnesium severely. Diuretics in coffee and tea also raise excretion levels of magnesium. Fluoride competes for absorption with magnesium, and our water is fluoride ridden, my friends. So why don't doctors check for this deficiency? Unfortunately, conventional medicine has not woken up to the amount of research that has been done on magnesium deficiency, and blood tests do not yield any information about magnesium. Why? Because the body controls the levels of magnesium, of the blood magnesium, very tightly. If magnesium in the blood drops just a little bit, you are going to have a heart attack. So to prevent this, the body will rob all of its cells, tissues and bones of magnesium in order to keep the blood levels constant. If you do a blood test for magnesium, the cells would be completely empty, while your blood levels will still remain constant, because 99% of magnesium in the body is stored in the cells that get robbed, while a mere 1% of body's total magnesium is in the blood. So in this slide, we will go through some of the top sources of magnesium, but as I mentioned earlier, although these foods are supposed to be rich of magnesium, we don't see this anymore. And there was a recent case study published in India about how the level of magnesium available in all of these ingredients, which is our wheat, almonds, spinach, cashew, soya beans, black peas or brown rice, how over the last 2 decades the levels of magnesium available in our foods has dropped by a good 83%. In which case we are actually just eating empty carbs. We are not getting any vital nutrients from most of our foods. So the best methods of getting magnesium: eat magnesium rich foods grown on organic soil, or take magnesium supplements. Applying magnesium oil to the skin is also a great methodology of dosing up your levels of magnesium, especially if you are not suffering a magnesium deficiency of sort, or you're not suffering anything which is a chronic ailment, or you're not on a therapeutic dose of getting treated for an autoimmune condition, but you are simply a normal person who also works out once in a while or has an active lifestyle, or you are a fitness enthusiast. Topical magnesium oil is one of the best methods after every workout, is what we would generally recommend. Soaking yourself in Epsom salt baths is also highly useful. This will provide not only magnesium but sulfur, which is actually very good for your liver health also. So now understanding which magnesium to actually use, because not all magnesiums are of the same. So magnesium glycinate, magnesium carbonate, magnesium sulfate and magnesium oxide. Magnesium glycinate is generally what we use for therapeutic dosing or for internal ingestion in a form of a supplement. Generally preferable method is we prefer using a powdered chelated format of magnesium, which is a complex of magnesium malate, citrate and bisglycinate, because it helps provide almost 8 times greater absorption without any gut irritation and has multifactorial utility across the body. So the next important cofactor in the entire Coimbra Protocol is vitamin B2 or riboflavin. So riboflavin or active form of riboflavin is called riboflavin phosphate. It is the central component of called FAD and FMN, and therefore they are required in the energy metabolism of the body. Vitamin B2 is required for a wide range of cellular processes, including transferring of oxygen from plasma to the tissues. It plays a key role in the energy metabolism and for the metabolism of fats, ketone bodies and carbohydrate proteins. Vitamin D activity and its dependency on vitamin B2 and magnesium and its availability is displayed through this image. So you can go through this and try and understand. You can Google about this a little bit more. You'll understand what we are trying to present over here. Now, activation of vitamin D3 requires availability of vitamin B2. So magnesium, vitamin B2 at level 1 at the liver level is needed for it to get converted to calcidiol, and then again at the kidney level, again magnesium and vitamin B2 are essential for its conversion into calcitriol. Another cofactor in the entire protocol is vitamin K2. Vitamin K2 occurs in different forms, but the most standardly utilized is what we call as menaquinine or vitamin K2. So vitamin K2 basically inhibits the vascular calcification. So what happens is when you are on a higher dose of D3 or a therapeutic dose of D3, not a supplementary dose, which is for the as I mentioned in the previous parts of the presentation, where the same line of treatment or therapy or a simple supplementation for a healthy living can be used for a normal person, and at a mega dose can be utilized for a autoimmune disease management. In general, we prefer using K2 predominantly more so for autoimmune type of disorders, just to ensure that there is no calcification, because on a higher levels of D3 the calcium absorption gets enhanced by the body in the gut. So for this calcium not to calcify in the arteries or in the gut or at the calcification happen in the small joints, or it can create a kidney stone. So K2 basically is that inhibitor of vascular calcification, but also it actually promotes bone mineralization. So it actually ensures that that calcium goes back into the bones and actually strengthens the bone, in which case reducing the occurrence of osteoporosis in the longer run. Especially this should be taken in note for women above that age of post-menopause, women whose ovaries have been removed surgically for for different reasons. And so they should actually, instead of supplementing with calcium, they should actually supplement with K2 and vitamin D, so that it ensures that the recalcification of the bones happens correctly over time. There are other functions of vitamin K2, which is it protects the bones from weakening, or it prevents fractures in the long run. It prevents calcification of blood vessels and the heart vessels. Now we cover another important cofactor, selenium, in this entire protocol. Selenium is a cofactor in the glutathione cycle and works as an antioxidant, which is very important for the immune system. It is a cofactor for vitamin D activation. It is an enzyme substrate needed for the production of thyroid hormones. Another cofactor, methylcobalamin. Yes, vitamin B12 comes in couple of different formats. What you generally find not only in India but also globally, over-the-counter supplements generally have cyanocobalamin, which our body actually cannot really absorb. So even if you've been supplemented, and when you get your blood work, that number that you see is just a sitting number, and the body has not been able to synthesize it or utilize it. In which case, I always recommend people to get a homocysteine test done, and that tells us how much B12 has the body been able to utilize and break down the homocysteine into the other enzymes. So methylcobalamin, B12, is involved in a number of body processes, but it's mainly in the formation of red blood cells production, nervous system function, sperm production, normal growth, the proper function of the entire immune system. Now coming to another part of the story, where gut health is one of the most important aspects of our entire health, and different pathies treat gut health very differently. Now, conventional medicine or allopathy does not pay extensive focus on the overall gut microbiota and the gut health or the digestive functions, but traditional types of medicines, which is like Ayurveda or traditional Chinese medicine or nutritional medicine, or not medicine but nutritionists, they focus quite extensively on the gut health because they understand the importance of a good gut microbiota. But what happens when we have weeds in the gut? Now, what are these weeds? In a beautiful farm, if there are weeds, they can destroy the whole farm. Yes? And so these weeds are amoebae, parasites, bacteria, viruses, candida and yeast. And all of them, if or any of them which are overgrowing or are uncontrolled, actually destroy the gut or damage with the gut and our entire immune system and the bloodstream, with a lot of toxin releases back into the system, which again occur as multiple symptoms in different organs, in multiple symptoms across the body. Vitamin D obviously is at the root of it, of immunomodulation, and it resets the gut. It helps reset the gut, in which case clearing the weeds out therapeutically in a right manner as a part of the protocol is what we essentially run for most of our patients, because gut health is also going to play a pivotal role in the overall absorption of nutrition from your foods and also your supplements. So this chart actually tells you about the importance of overall management of health, where healthy food, exercise, vitamin D activators like magnesium, boron, zinc, iron, vitamin K2 and omega, all of these come together. So as I said, the king and its army, they have to come together to help you manage your health much better. So to summarize the entire cofactors list: magnesium, selenium, zinc, riboflavin, methylcobalamin, omega fatty acids and vitamin K2. But the list is not only limited to this. Over the number of years, with our experience of what we do for thousands of patients, when we say that there are other organ systems involved at times in a chronic lifestyle disease or an autoimmune disease, and we need to treat those organ systems also, for which we have integrated other complementary systems of therapy and medicine to help tide over and heal those organs and localize inflammations in those organs or their functionings. Essentials for therapeutic success: vitamin D at therapeutic dosages under supervision to prevent calcium toxicity. Micromanagement of dosing along with monitoring is mandatory. Right supplements with the right potency and the right quality, right cofactors for the success of the therapy is a must, and it is a not negotiable. This we see at the practice level, where a lot of patients are excited to start the vitamin D therapy thinking that, oh, I just need to take vitamin D, which is all right. But when we put down the protocol for them and they go, oh, but I do not want to take so many medicines or supplements, and we have to really explain to them that please understand that without all of these, the protocol 1 cannot be run, and it is insufficient, it is incomplete, and it can then actually cause damage rather than any good. Second, whatever supplementation as a part of the protocol is a part of an entire metabolic pathway, which is how your body actually functions. In which case, supplementing with the cofactors is mandatory must for an overall healthy lifestyle or managing an autoimmune disease. So thank you so much for attending this entire presentation and understanding the Coimbra protocols and the vitamin D as a therapy for autoimmune diseases, chronic lifestyle diseases, and chronic pain disorders. I hope I will see you in one of our next presentations on different subject matters. And if any of you need to reach out to us, you can find us just on Google by putting down our name. The clinic name is Cure for Pain. You can reach out and we will be more than happy to help and guide you. This entire system or the methodology of treatment with the vitamin D as a therapy for autoimmune diseases is not actually expensive and much more holistic, natural and comprehensive line of treatment suited to the needs of the modern man in today's times. Thank you so much, and I'll see you later.